I think everything that you said is so important. And what I'm thinking about, because I'm a physician, is, the role of physicians. And so, what message do you have for healthcare providers who are in this space and in improving inclusivity and sensitivity to the issues in maternal health care for Black women, for Brown women? What would be some of your advice?
I love this question because I have the privilege of working with so many healthcare practitioners. And, through the NIH, we have a grant to work with Northwell Health where we train their nursing staff in our doula training. So they have doula competency, which I think is so important.
Mhm.
And we're doing a longitudinal study, and so that study will also like look at the program that I've developed, and also like how we can impact care within these institutional settings, right? Um, we're also doing work with Montefiore Medical Center, where we have a HRSA grant with them to look at the impact of doula support on populations impacted by trauma. And so we have to work together, right?
Mhm.
What I see is important is really to be open minded and to like interrogate what comes up for us around the feelings that surface, because what I find is like first defensiveness, like, oh, that's not us, or that's like, I don't want to own that part of, you
Mhm.
know, the medical story or the history, right?
Mhm.
That's not me, right? But
Mhm.
it's like, it's not about that. It's really about like, well, as an individual who's invested in and operating within a system, like, how can we look at how that system is functioning and see how we can do things differently or better? How can we improve on and actually expand upon our skill sets, right? So, if I went to medical school, there's a lot of things that I didn't learn, right?
Right.
And that's okay. That's okay, right? Like,
Right.
right? Everybody learn. There's a right. There's a kind of a, um, I mean, there's a ceiling to what you can learn inside of a
Right.
time frame. Right? We understand.
Right.
So because of that, though, it means that ongoing education is important, and continuing to improve on that education is important. And so that's why we develop CMEs, so that
Mhm.
doctors can continue their education, and CEUs for like different other care practitioners. Um, we developed an amazing program for nurse care managers with Aetna CVS to train them and do a competency for CEUs. And it was 100% attended because they were getting that credit, but they gained something that they didn't know that they were
Sure.
coming for.
Right.
And so, what I would encourage is that if you are proximate to birthing individuals, pregnant people, people who are navigating high risk pregnancy, like wherever people are, go take some courses outside and that are not provided necessarily by your hospital or your institution, but
Mhm.
like look into other spaces and go learn from people of marginalized identities,
Sure.
right? Like go learn from queer folk, go learn from Black folk, go learn from POC folk, right? Go learn from everybody
Mhm.
so that you can integrate a different perspective
Mhm.
and bring softer skills, but also empathy into your work
Sure.
in ways that are necessary. Now, when I talk about empathy, like I don't want a surgeon, right? When they are, cutting me open to be empathizing, I want them to be right, like surgical. But
Right.
before they cut me open, I want
Right.
them to sit on my bed, and I want them
Right.
to just hold my wrist and rub the inside of my
Sure.
wrist, and sit with me and look me in the eye and
Right.
talk to me about the course of care. I
Exactly.
want before a cesarean for people who are going to be in the OR to walk over and to sit and say, I know this is not what you wanted.
Right.
And um and yet this is where we are. And I'd like to know, how can we make you feel comfortable in the room? There are
Right.
some things that are in your control. What music do you want to have playing? Would you
Mhm.
like to have would you like to see the birth? Would you not?
Mhm.
Would you like there are some things that we can do to make it more
Sure.
humane, right? So that I can feel
Absolutely.
dignified in the experience, right? Like these
Right.
are ways in which we can improve the experience and put hospitality into hospitals, right? It's a way that we can also think about like how someone recalls the experience, because what doulas do is we think about, we're so invested in actually the memory of your experience.
Sure.
That's actually my job, is to think about how you will remember it, how you will recall it, and the story you will tell. And so I'm
Mm.
invested in that story, and I'm invested in how you tell that story. And if more physicians were invested in how someone tells a story of their experience, they would
Yep.
do care differently,
Mm.
right? So to think about care from this lens of an individual experience that is life altering,
Mhm.
and but it could also be life affirming. And so let's make it life affirming, and let's think about ways in which we can honor what's happening for everyone out in the world, but at the same time lean into lean into our own responsibility to continue to self develop, self improve, and bring in and harness these new skills so that we can do care differently, and that will
Mhm.
change the culture of our medical spaces, right?
Yes.
Like
Yeah.
that. So if individuals work together to do things differently, that actually shifts institutional culture. And that's what we would like to
Yes.
see, right? And I
Yeah.
think that's possible, right? So
Mhm.
I love working hand in hand with physicians. I love working hand in hand with nurses. I love working with staff around these goals because I know that they're possible. Like we can do it differently.
Right.
It's a choice. And
Right.
so I would love to see the advice that I would have would be to, invest in, like I said, marginalized education from marginalized people who are doing this work that
Mhm.
are able to come into your spaces to teach you, or you go into their spaces to be taught,
Right.
and honoring that work, and then figuring out ways to like bring it in, right? So how can we bring this
Yep.
work in, not just taking like, oh, check, I took the anti-racist class
Right.
2 hours back, right? Not this, because we're talking about hundreds of
Mm.
years of framework that's embedded in our institutions. You're not undoing that in a 2-hour course. But what you can do is you can start to engage over time, reading, workshops, exercises, dialogue, right?
Mhm.
Podcasts, you're in one right now, right? Like
Right.
really using these tools that are available to you, and seeking the teachers, right? Seeking the work. We have an amazing training program. It's in
Mhm.
person, finally for the first time this year in April, but then it's also online and widely accessible. And so there isn't an excuse, right? If you want to do it, you can. And
Right.
if you want to do this for yourself, and I would also say, because a lot of us orient around, okay, I'm doing this for other people. No, do it for yourself. Do it for yourself, because when you do it for yourself, when you show up for yourself in this way, I'm going to dedicate this time to learn these things, it will spill out onto everyone. That's just like
Absolutely.
part of it, right? So that would be my sincere hope and my prayer, more than my advice. It would be my prayer that people do that work so that we can make things better, because we can't rely on like an institution itself to make this change, the
Right.
board, the investors, or even the lawyers and the
Right.
insurance. Like we can't. We have
Right.
to rely on individuals to say,
Mhm.
I can change this moment, this interaction, this one.
Mhm.
I
Right.
can make it better. And so that's what I would like to see. And I would like to see, more people being held accountable, and also more people feeling like they have the safety to bring practitioners to account when things happen that, um, should be spoken out about.
Mhm.
People have to feel safe to be able to say something and surface that information. And so I hope that we can also create what I would love, like in a dream world, would be a safety net also for people who are whistleblowing, right? So that we could
Mhm.
also make our institutions safer.